Pro Group Management. Workers' comp that works for you.
Welcome to Nevada Newsmakers. I'm Randi Thompson, sitting in for the vacationing Sam Shad. Today we'll be talking with two emergency room doctors about COVID and why it's important to get vaccinated. Coming up on an all-new Nevada Newsmakers.
Modern boutique Ahern Hotel and Events Center in Las Vegas. Host meetings and events on 2 floors. Stay in luxurious rooms and suites. Unlimited branding opportunities. Regional Italian cuisine by Chef Mark Segrisi. Flexible event spaces. Full buyout options. Visit ahernhotel.com today.
I'm Jeff Gehrman, an investigative reporter with the Las Vegas Review-Journal. I'm your guide for Season 2 of Mobbed Up, The Fight for Las Vegas.
You're in with every gangster and hoodlum in the United States.
I don't go for that, Mr. Kennedy. I don't go for that kind of action.
I was on television accused of fronting for the mob.
Subscribe to Mobbed Up, The Fight for Las Vegas, Season 2, today on Apple Podcasts, Spotify, or wherever you get your podcasts.
What do you count on? You count on your power every day. At NV Energy, we've always powered what's important to you. But we're not looking at the past. We're focused on the future. While our standards are high, our rates will remain low. And our commitment to renewables isn't just meeting standards, but leading the way. Because you can count on more than just your power. You can count on the company who brings it to you. That's our promise. You can count on it.
Before the masks, before the distancing, before the world changed, UMC was ready. Our response to COVID-19 began before the crisis did, with our own team of infectious disease experts who've spent their careers planning for this moment. With a pandemic response plan, we'd practiced again and again, and by blazing new trails in large-scale testing, including every patient we admit. Always ready. UMC.
Nevada Newsmakers Studio is located at the headquarters of the Nevada Trucking Association. Motion and purpose are a truck's greatest virtue.
This is Nevada Newsmakers with host Sam Shad, a no-holds-barred political forum. Now, from the Nevada Newsmakers broadcast headquarters, here is Sam Shad.
And we're back on Nevada Newsmakers, and I'm happy to have back this week Dr. Jenny Wilson, who's Medical Director of the St. Mary's Emergency Department and also of REMSA Health. And joining us today is Dr. Meg Jack, who is the Emergency Physician as well as Medical Director of the Carson Tahoe Emergency Department. Got to make sure you get those titles right, because that matters. So thank you both for coming back. I want to give one statistic that folks might not be aware of. Washoe County reported its 800th COVID death this week. And it took a month and a half to get to 100 deaths in Washoe County. And the last time we reached 100 deaths, it was about 8 months. So we're seeing an escalation in death related to COVID. You ladies signed a letter, and you got a bunch of other people to sign a letter. Why don't you tell me a bit about this letter?
We wrote the letter because we need the community's help. So the thing that's different this time around is we're seeing young people die, and they also have the choice at this point to get the vaccine. So really it's a point of living versus dying, and it's a choice.
And it's that clear cut. Vaccine will save your life.
Yes.
Okay. What are you seeing in those that are coming in to your ERs that are not vaccinated? What are the symptoms?
The majority of the patients who come in infected with COVID are unvaccinated patients, and between 95 and 99% of patients occupying intensive care units in, I believe, every state, but the states for which statistics are reported by their departments of health, they are unvaccinated patients. Mild COVID maybe could stay at home or be taken care of at urgent care. That would be one little plug. However, when COVID moves beyond the upper respiratory tract, it tends to infect the lungs. And a super classic chest x-ray finding is something called bilateral pneumonia, which just means on both sides. People they're incredibly breathless. That is fairly uniform in our experience. They can't walk. I can't tell you how many stories I've heard where I can't walk to the bathroom from my bed. And this is from, a 41-year-old guy yesterday, or 2 days ago, it was a 51-year-old guy who said, I get out of breath, and he interrupted his entire storytelling by this hacking cough.
Oh boy.
And we are, I mean, not to be sappy, but we care about our patients and how they feel. When I see somebody in pain, I am so grateful that I am able to do something about it, and I ask the nurse to go get some pain medicine at that moment, for the most part. When I see somebody who is that unhappy with their breathing and that uncomfortable with their coughing, and they were just a normal, healthy person, a week ago, it really is, it's heartbreaking. And that's part of that is the impetus for me behind all this. Meg said to me probably about a month ago, do you want to write a letter encouraging people to get vaccinated? And I said, hell yes, I do.
Yeah. So these aren't people with a lot of underlying medical conditions like was first reported with COVID. The comorbidities of heart disease, of COPD, of obesity. These are average, healthy, and sometimes even younger than 60 adults who are seeing really strong symptoms and death.
We're seeing both. So people who have underlying medical symptoms are definitely getting sick, but it's the healthy ones that are getting sick as well, which makes it different, including pregnant women.
And children.
Mm-hmm.
And children. And is it because it's this Delta variant? Is that really what's made the difference? Is this variant of this COVID?
I think it's both. I think the Delta variant is very contagious, but also people aren't social distancing. Some people aren't wearing masks, so there's a little bit of a component of that as well.
Okay.
The numbers are just what's so striking, and I remember when the pandemic first started, I did some sort of math on some little news piece, but it's the concept of exponential growth. And I think it's hard for people to understand. If I gave you the choice, now I think you know where I'm going with this, but if I gave you the choice, I can give you $1 million right now, today, and I can't, by the way, or I'll give you a penny today, and then every day for the next 30 days, I will give you twice as much as I gave you the day before. At first blush, you'd say $1 million right now, a penny, that's tiny. But like I said, you know where I'm going with this. After a week, you've only got, I'm giving you 64 cents on that day. And even after day 21, it's only $10,000. On day 30, it's over $5 million. Now, granted, it's in pennies. That's not so practical. But the point is, if that is viral spread, and it doesn't exactly match, that model doesn't exactly match viral spread, but the point is the blossoming and the numbers grow late. So if there's a surge, if everybody decides to celebrate like they did last Halloween, then a few weeks later is when we see my scaredest, the time I was the scaredest, besides right now, was kind of the end of November, beginning of December last year, because I thought it is out of control. We don't have the resources to take care of this many patients. There's 500,000 or so acute care beds in the country. So even if a small percentage of those people are hospitalized, we're gonna use up our resources, and it's gonna be a disaster. It already kind of is a disaster for all, even the healthy people.
Well, and we're going into the fall/winter season. People are going to be going inside more. Does that concern you as well?
Absolutely.
Yeah, because there'll be inside more. There'll be more, breath indoors versus being outside and being a little healthier. All right, we're going to continue this conversation right after this.
Get in on the Tamarac Casino's $175,000 Hidden Treasures Guaranteed giveaway now through September 30th. Earn entries in the weekly drawings and win big during the two $35,000 grand prize giveaways. Your good times are at Tamarac Casino.
I can't do it. Stupid, like my mom.
We can't do anything at Mommy's because you won't pay child support.
Dad said you cheated, and he's not even sure he's my dad.
Mommy said you left both of us, so she isn't gonna let me see you. I look just like my father.
I'm divorce attorney Marilyn York, and I may represent men, but hate has no gender, only casualties. Please, stop sacrificing your children in your war against your ex.
Serving Our Kids Foundation's mission is to serve homeless, at-risk, and food insecure children in grades K through 8 throughout Southern Nevada. During the pandemic, Serving Our Kids has seen a 42% increase in the number of children served, providing more than 4,500 meals to kids in over 100 schools weekly. Serving Our Kids is powered by community support and volunteers. To learn how you can help, visit servingourkids.org.
The Do It Right guys at Nevada Heating have one mission. Your furnace breaks down today? We fix it today. Why freeze for days while your furnace is down when Nevada Heating can get the job done today and you can get warm again? For nearly 50 years, locally owned Nevada Heating has been getting the job done right. Call today at 323-5585 and we'll fix it today. That's 323-5585 or online at nevadaheating.com.
Get in on the Tamarac Casino's $175,000 Hidden Treasures Guaranteed giveaway now through September 30th. Earn entries in the weekly drawings and win big during the two $35,000 grand prize giveaways. Your good times are at Tamarac Casino.
This is Nevada Newsmakers.
And we're back on Nevada Newsmakers with Dr. Jenny Wilson and Dr. Meg Jack. Sorry, I have a friend named Meg Kent. I keep wanting to say Meg Kent. Okay, so I'm a Republican. Anybody that knows this show knows me. I'm a rabid Republican, not a wacko, just a rabid. And I'm vaccinated. And there has been quite a politicalization of this vaccine. Early on, when it was under the Trump administration, you had Biden and Kamala Harris saying, I'm not going to take the vaccine if it's under Trump. Well, now it's under Biden, now they're taking the vaccine. So we've set ourselves up for failure to some extent by politicizing our country so much. And now we've politicized COVID and we've politicized the vaccine. And that's what's so frustrating to me is how do you guys address this is a medical issue, not a political issue?
I agree. If you ask any of the frontline members, we're seeing this. We've been working with it for a year and a half. It has nothing to do with politics. It's living or dying. It's truly that simple.
And how are you getting that message out?
It's truly a choice. So there's a Rush song that says, if you choose not to decide, you still have made a choice. And if you choose not to get the vaccine, you are choosing the virus. You are choosing to allow it to live. You're choosing to allow it to propagate. We don't approach, I don't know about Dr. Jack, but we don't approach the conversation involving politics at all because it's frankly, it's irrelevant. We don't approach with any of our personal opinions of incredible frustration. You know, we keep that at bay. What I have found helps, and I'm really kind of on a crusade and have been for a long time now, what I have found helps is just finding out what it is that people have questions about, what forms their hesitancy. I know women trying to get pregnant women, breastfeeding women, they're super concerned. And I say to them, the American College of Obstetrics and Gynecology and the Society for Maternal Fetal Medicine both recommend that women trying to get pregnant over the age of 12, pregnant women and breastfeeding women get vaccinated. So they're like, they do? Yeah, they do. So your social media friends who are telling you otherwise and telling you anecdotes, and I had a friend who, they are doing you a disservice and you should unfriend them. But I find that if you just approach what it is that somebody has a concern about, and you can try to educate them. And there's sometimes people ask me things that I don't know the answer to, and I know where to look it up, and then like together we can figure it out. And I find if you take it methodically and just talk to one concerned patient at a time, I have been able to, I'm heartened because I see that people really, they want to give up this fight. They don't want to get on their they would like to get off their soapbox, get vaccinated, keep their job, be able to travel internationally, save the world from this pandemic. They want an excuse to get there, and I want to provide that for them.
So I think a lot of the concern is, one, the efficacy, how is it working, and two, it's an mRNA virus, mRNA vaccine. Tell me a little bit about that, because it's been around for a while. Coronavirus has been around for a while, but mRNA is it's a long studied process to create vaccines, right?
Mm-hmm. Yeah, it is. It's actually not very confusing. It's actually beautifully simple. So since 2011, the mRNA technology is not new. So the logic is you take a thing that you would like to kill, like a cancer cell. So mRNA technology has been used in the development of cancer medications in the past. And you take a part of it that our body would recognize, and you say, what makes up that part of it? So in the example of coronavirus, it's the spike protein. So you're like, it's got a little spike here and a little pedestal or whatever it's made up of. You get the recipe for that, the very recipe that the virus made the spike protein from, and you take that and you take the recipe and you have to wrap it in a little lipid molecule. It's a little butter ball, so that it doesn't get degraded. This is a tiny little thing that has to be protected by this lipid molecule in order to get into your cells. That's what's in the vaccine, no microchip. So you inject that, that's what's in the vaccine, you inject that into a person and it goes into their cells but not into the nucleus. So the nucleus is where the DNA lives. This does not have any bearing on our DNA. So our cells are getting messages all day long, little mRNA pieces saying, make this so that you can digest fats, make this so that you can, so they are transcribing, they are expressing proteins all day long. This comes in line with all these other mRNA messages, messenger RNA messages. It only lives in your body for a couple of days, and it says, here, make a spike protein, and whoever the cook is that day takes the little order, makes a spike protein, it gets expressed on the surface of your cell, and then that thing, like a Post-it note, it goes away. Or it was also explained, depending on what generation we're talking to, it's like a Snapchat message. It's gone. So it's not going to do, so anyone who has any reaction to the vaccine, it's an allergic reaction, usually to the glycoprotein molecule.
To the butterball. To
the butterball, exactly, if they're allergic to butter. So then once it's expressed on the surface of the cells, your body produces, if you've got an immune system that's not immunocompromised, it will form an antibody. It will recognize that, say, that's foreign. I haven't seen that before. I'm going to make an antibody against it. It makes antibodies. The spike protein goes away. The antibodies hang out, and they might never do anything again. Or if you get exposed to COVID, now they recognize it. And they don't completely prevent disease. There are definitely some breakthrough cases. They're fairly rare. But the important part is they really do prevent hospitalization. If you get sick with COVID after you've been vaccinated, you will have a much, much milder course. Like I said, the only people who are in the intensive care units, 99% of the people in intensive care units with COVID have been unvaccinated. There's some unlucky vaccinated people who maybe couldn't mount that immune response because they were immune compromised to begin with. So it's super simple, and that's why it was authorized so quickly, because that technology, you could take any virus and any part and just figure out what its RNA is coding for and drop it into the system.
All right, that was our Vaccine for Dummies 101 section. We'll be right back after this.
7 at 7 is available anytime, anywhere.
I'm Riley Smith with your Vegas Golden Knights. Watch 7 minutes of nonstop news from the Las Vegas Review-Journal.
Streaming on LVRJ.com and YouTube, powered by the Las Vegas Review-Journal.
I'm Jeff Gehrman, an investigative reporter with the Las Vegas Review-Journal. I'm your guide for Season 2 of Mobbed Up, The Fight for Las Vegas.
You're in with every gangster and hoodlum in the United States.
I don't go for that, Mr. Kennedy. I don't go for that kind of action.
I was on television accused of fronting for the mob.
Subscribe to Mobbed Up, The Fight for Las Vegas, Season 2, today on Apple Podcasts, Spotify, or wherever you get your podcasts.
As you know, Reno is booming. Toll's development company is helping it grow with insightful design and development, building community with every project, adding beauty, adding excitement, emphasizing our shared humanity. Reno is becoming bigger. Toll's development is helping it become better, more livable, more enjoyable. To learn more, go to tollsdevelopment.com. tollsdevelopment.com.
Modern boutique Ahern Hotel and Event Center in Las Vegas. Host meetings and events on 2 floors. Stay in luxurious rooms and suites. Unlimited branding opportunities. Regional Italian cuisine by Chef Mark Segrisi. Flexible event spaces. Full buyout options. Visit ahernhotel.com today.
Retail's impact on Nevada's economy? Enormous. 8,600 businesses, large and small, employing 145,000 workers. And last fiscal year, retail paid tax on nearly $60 billion in sales. We're the Retail Association of Nevada. We support retail, we help it grow, and we mean business.
RANNV.org.
7 at 7 is available anytime, anywhere.
I'm Riley Smith with your Vegas Golden Knights. Watch 7 minutes of nonstop news from the Las Vegas Review-Journal.
Streaming on LVRJ.com and Twitter. Powered by the Las Vegas Review-Journal.
This is Nevada Newsmakers.
And we're back on Nevada Newsmakers with two emergency room doctors who are also medical directors, Dr. Meg Jack and Dr. Jenny Wilson. So people are, this is the segment I said, if you haven't gotten the gist that we want you to get vaccinated, we're going to scare you to get it vaccinated. People are living with COVID after. I mean, one, if they've survived the incredible hospital bills that nobody probably really wants to talk about. What are the symptoms you're seeing people who survive with COVID?
Well, there's people that have chronic pain, joint pain. There's people on oxygen and they're still short of breath even when they're on oxygen. The renal failure, people with GI symptoms, problems with their colons. Basically, any part of your body that could get affected does get affected, and everyone's different. Some people have neurological symptoms and they don't go away, so that's really difficult for young healthy people too, because they were normal before. So it's been really hard to see.
Yeah, what's the most challenging thing you've seen in some of your patients? Or disheartening or frustrating, however you want to look at it.
I have such a long list. Watching people suffer, for anybody, but especially I think it's the juxtaposition of the fact that it is so devastating. Having trouble breathing, I mean, I have, my whole life, I've felt sorry for people with COPD and asthma, because you watch them do that. It's different than pain, and there's not always a ton that you can do about it. The juxtaposition of watching the suffering, which is usually in the breathlessness, total body aches. I mean, I can't even imagine what these body aches must feel like, because people are miserable, profound fatigue. Watching that and then having the knowledge now and since December that it was preventable, or getting that serious was preventable, those two things together, that's the most heartbreaking thing for me, to think you could have, there was a way. It's a race between the virus and our immune system. And frankly, it's a race between the virus and our entire healthcare system. And the vaccine gives us such a head start. It obliterates the race. There's no race anymore. If you get a vaccine, the virus is really not likely to beat you. If you get a vaccine, you're not likely to even get an asymptomatic infection. So then when you go on the bus, or when you're sitting in the waiting room in one of our emergency rooms for 4 or 5 hours, you're not going to transmit it to somebody else, and you're not going to cause that to happen in them. So it's very frustrating. The most devastating thing happens to be someone who I kind of peripherally knew anyway, and he's 42 years old, and he didn't get vaccinated, and he was intubated for a period of time, and then he went home, and then I saw him back again because he had developed a problem around his lung, so that every breath he took felt like a stabbing pain along with his breathlessness. He's got 3 children and this wonderful wife and this great family, and he was totally healthy. No one knows why it happens to those people. And I don't think scare tactics saying you are likely to be that sick, I don't think that helps, because the statistics show that 42-year-old was not likely to get that sick. But the idea that you could even give that inadvertently to somebody who could get that sick, that's the part to me that's not fair. So that was a particular heartbreaking case to me, because his life, he's the one who said it. He said, my life it's not over. It's changed forever. He's crying. He's a grown man crying because he's in pain and he's breathless, and he doesn't know how long it's going to last, and neither do we.
Oh boy. So it doesn't matter really the age at this point. I mean, as doctors, what are you recommending? Anybody over 18? Anybody over 12? Where are we on the young adults?
I think we go with what the CDC recommends. They're recommending 12 and older, and they're studying it to be younger, and I think that should be coming out this month. But I think anybody who is above 12, we would recommend getting it for sure.
And it's not just those that are the most likely. It is not the COPDs and all that kind of stuff. It's everybody.
At this game, it's a Russian roulette, right?
Yeah.
The risk versus benefit is where we are right now, and so everybody takes risk differently, and so that's what we're trying to get through, is that it is a risk. Yes, you probably will be okay, but what if you're not?
I think a lot of the frustration for folks is, okay, I was told if I got vaccinated, I wouldn't have to wear this damn mask anymore. And we're still asking to wear masks. Are they effective?
They are, and what you're trying to do is decrease viral load. So if you have a mask on and I have a mask on, the viral load that is coming out of both of our mouths will be less. So it's not perfect, but nothing in life is perfect.
Okay, but they are working. Even the one I get that has nothing on it, but a cute little, one of my favorites is this mask is as effective as our governor. So yeah, that's one of my favorites. But so we should be wearing masks just to do the right thing.
We should be wearing masks, we should be aerating. And I think in addition to it being Russian roulette, people have to realize that even if they're going to win in the Russian roulette game and they're not going to get sick, they are going to potentially transmit it to others. And until all of us, or 85%, whatever the herd immunity level is, are saying, no, virus, you may not, I will not be a host for you. Until we're saying that, the virus will find a place to live. You are choosing the virus if you're not choosing the vaccine. You're choosing it, if not for yourself, you're choosing it for others. And you're choosing it for your healthcare community, which is sitting here begging you to please get vaccinated.
Well, I thank you guys for your tenacity in this and for being on with us today. And in case you didn't get the message, get vaccinated. We need to say this one more time. Get vaccinated.
Please get vaccinated.
Please get vaccinated. Please help us help you.
Exactly. Please don't overburden our hospital system, which is already extremely burdened. So we'll be back right after this.
Brian Culpa Photography was born in the rolling hills of Massachusetts, and now he can help you experience the stunning beauty of Nevada in a whole new way through the power of flight. Flying has always been a passion for Brian, and at Brian Culpa Photography, he can make your imagination soar. Brian has the creative mind and tools to tell your unique story. Experience the bird's eye view at brianculpaphotography.com.
Hi, my name's Marilyn Miner, and I'm sure you'd agree that Nevada's a very special place to live. I was born here, and my husband and I have raised our family here. I feel it's a privilege to live and work in the Truckee Meadows. I especially enjoy helping my clients reach their real estate goals. Sometimes the smallest details provide the greatest satisfaction. I'd be complimented to talk to you about your next move.
Call Marilyn Miner at Dixon Realty, 742-1280, or log on to marilynminer.com.
Safety. We all think about it. You think about it when he buckles in, when you check your mirrors and put away your phone. RTC thinks about safety too. In fact, we create it. Center turn lanes mean fewer blind spots. Bike lanes keep cyclists and you safe. Roundabouts reduce injury collisions, and all these crosswalks are designed to keep families like yours safe. Safety is your priority, and it's ours too. Every day, in everything we do.
Pro Group Management is the place where companies can find workers' comp solutions that are designed to meet their specific business requirements. As regulations evolve, Pro Group takes a proactive approach to clear the path to make sure your business stays ahead of the curve. Knowing your workers' comp program is optimized, you can focus on other important matters related to your growing business. Pro Group Management, workers' comp that works for you.
Thanks for watching and listening. You can catch us anytime on our new YouTube channel, Nevada Newsmakers. Thank you. Hey, Mom.